Assalamu alaikum, respected doctors. Welcome to my YouTube channel, MBBS and BDS lectures. Today's the video number on our YouTube channel is 384. Mean 383 same videos are present on our YouTube channel. And today our lecture is related to general surgery. And today our chapter is burns part 4. Mean this is the fourth video of burn chapter. Now, if you are interested in more videos of general surgery, I have two playlists on my YouTube channel where I cover the whole important topics of general surgery. There you can find videos in a sequence manner like appendicitis definition, causes, clinical feature, investigation, mean part 1, 2, 3, 4, 5. All these playlist link I will put in the description of this video. You can directly go to the playlist by clicking the link. Now, today our topic outline include pathophysiology of burns. Now, pathophysiology of burns we will study in number 1 in local changes. Second is systematic changes due to burn. First we start from local changes. What will be local changes due to burn? Mean the area which are directly exposed to the burn. What will be changes in these specific area? Now, in local changes, thermal injury causes coagulative necrosis of the epidermis and underlying tissue. Like in first video, we already studied what is burn. Burn is the example of coagulative necrosis. Now, second is the depth of injury depend upon three factors. Number 1, depend upon temperature to which the skin exposed. Second is the specific heat of causative agent. Third is the duration of exposure, mean for how much time this area exposed to the burn. Now, next is the Jackson thermal wounds theory or zone. Jackson zone of thermal injury. Now, these are the Jackson theory is the or zone is the most important topic in local changes. Now, the area of cutaneous injury has been divided into 3 zones, which is called Jackson thermal wound theory or zone. Number 1 is the zone of coagulation. This is the most inner zone, also known as zone of necrosis. In zone of coagulation, there is the necrotic area of burn where cells are disrupted. This is the inner zone. Second is the intermediate zone, which is called zone of stasis. This is the intermediate zone. In zone of stasis, its area surrounding zone of coagulation where vessel leakage and vessel damage present. This is a zone of stasis. Now after zone of stasis, come to the third zone, which is zone of hyperemia, which is the most outer zone, mean outer zone. In zone of hyperemia, it is area where vasodilation and inflammation is present. These are the 3 zones of Jackson, which is present in the superficial skin or cutaneous injury. Now we will study by 3 to 4 by help of 3 to 4 diagram. Look at this diagram. Jackson theory of thermal wounds. The most inner zone, which is yellow, is the zone of coagulation, then zone of stasis, which is reddish, and then is zone of hyperemia, which are shown in reddish brown color. Now, it is actually, if we can understand by example of burger. In burger, there's a lower, in burger, upper part is the bread, lower is the bread, in between there is a salad. Same here is the skin, the innermost yellow is the zone of coagulation, then reddish is the zone of stasis, then zone of hyperemia. Look at this diagram here. The most inner red zone is the zone of necrosis or zone of coagulation. Then less reddish is the zone of stasis, and the outermost less reddish is which is very less reddish is the zone of hyperemia. Now after local changes, come to the systematic changes. In systematic changes, we will study changes due to burn in each system of our body. First, we start from CVS. In CVS, number 1, blood pressure fall due to fluid loss. Second is the due to fluid loss, when blood pressure fall, in the result there will be reflex tachycardia. Third is the decreased cardiac output. Why? Due to less venous return, and due to decreased cardiac output there will be decreased tissue perfusion. Now come to the second system, which is the respiratory system. In the respiratory system, number 1, there is the majority of the death from fire are due to smoke inhalation. Due to smoke inhalation, majority of the death occur. Now, second is the pulmonary damage due to direct burn injury or systematic response to injury. The third is the damage to the cilia and cell in the airway. In the result, there will be inflammation. And the fourth is the pulmonary edema due to fluid escape to interstitial area. Now, due to inflammation and pulmonary edema, there will be airway obstruction. Now come to the third system, which is GIT. In GIT, the most important change due to burn is the curling ulcer, which are very important in theory as well as viva. Now, what is curling ulcer? It is gastric or duodenal ulcer due to decreased GI blood flow and mucosal damage. Due to decreased GI blood flow and mucosal damage, the ulcer in gastric or duodenal ulcer is called curling ulcer. Now come to the fourth system, which is renal system. What will be changes in the renal system? Renal blood flow and GFR, glomerular filtration rate, decrease due to hypovolemia. In the result, there will be oligouria, mean few urine, and hypovolemia is due to fluid loss. Now come to the fifth system, mean immune system. What will be immunologic changes? In immune system, our first line and second line defense will be destroyed. In the result, there will be the burn patient very prone to infection. Number 1, skin barrier to invading organism destroyed, which is first line defense. Second, circulatory level of antibodies, WBC, neutrophils, phagocyte decrease due to blood loss. This is second line of defense. Now, in the result, there will be, due to all these changes in immune system, burn patients are more susceptible to infection. Now, we studied the local as well as systematic changes. Mean part 4 is end. In 5th and 6th videos, we will study about assessment and management of burn. Now, today our topic is end. We have Telegram channels and WhatsApp groups for you people. If you are MBBS student, we have Telegram channel by name First to Final Year MBBS Lecture, where we daily share notes, books, videos. And if you are BDS student, we have Telegram channel by name First to Final Year BDS Lectures. And we have also BDS group for first year BDS boys and girls separately. There everyone can share notes, books, videos, and also can request for books, notes, videos. And also we have second year BDS group for boys only, and third year BDS group for boys only. In future we will create for girls also. Now all these channels and WhatsApp groups links are present in the description of this video. You can directly join by clicking the link. Now, if you like my video, press the like button and share this video with your friends. If you new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.